Okay, so today we're going to go over the musculoskeletal system, chapter guidelines, and we're also going to go over some common procedures that you're going to find in this section. You're going to have 5 questions to answer on case scenarios, and you're going to also match those case scenarios with the correct guideline. And then you're also going to need to match the procedure with the actual picture that depicts that procedure. All right, site and laterality. So there are some guidelines associated with this. Sometimes you're going to find a code where it's going to say that there are multiple sites. And so in this case, we can use the code with multiple sites instead of listing each site in multiple codes. So for this particular one, it's rheumatoid arthritis of multiple sites without rheumatoid factor. So rheumatoid arthritis patients normally have issues with more than one site. They'll have issues with their shoulders, their hips, their elbows, their wrists, their knees. So in lieu of doing several different codes for those types of patients, you can just use the one code for multiple sites. This next example, osteomyelitis, does not have a code for multiple sites. So in this case, we're going to use our fourth for this case scenario where there's osteomyelitis of the fourth thoracic and the second lumbar vertebrae. You're going to have two codes, one for osteomyelitis of the vertebrae in the thoracic region and one for the lumbar region. And also remember, your osteomyelitis is your infection in the bone. Okay, so always go back and review your medical terminology when we're going over each chapter so that you know what you're reading and you know what you're coding. All right. Bone versus joint. So, although a diagnosis might say of the joint, um, where the site designation will be the bone. So in this particular situation, your idiopathic avascular necrosis of the femoral head of the left hip joint, um, your M87.052 is idiopathic aseptic necrosis of the left femur, because your left femur is the bone that's creating that joint. So your necrosis is actually in that bone, that left femur. So you need to remember when you're coding things of this nature that although a portion of the bone is affected, may be at a site of a joint, your remember where your disease process is. So necrosis is in the bone, and so your designation will be to the bone and not the actual joint. Make sense? Hopefully. All right, so acute traumatic versus chronic or recurrent musculoskeletal conditions. This is acute traumatic buckle handle tear example. So when it's an acute traumatic tear of the meniscus, then those are going to code to chapter 19 and see how this code starts with an S83. That means that it's from chapter 19. It's an acute traumatic tear. Versus our old bucket handle tear of the right medial meniscus. Those are going to be the ones that are for chapter 13 with an M23.203 is going to tell the story of an old meniscus tear or injury to the right knee. And a bucket handle tear, if you look at the picture, what it is it's in the knee, and when your knee goes the wrong way, one way or the other, it grabs onto that meniscus and it makes that tear. And the actual tear of the meniscus looks like a bucket handle. Pathological fractures. So, with pathological fractures, we're going to use a seventh digit A or D, which is subsequent visit. Um, but the A, although it says initial encounter for the fracture, it doesn't always mean that there was just one encounter for that fracture or the initial encounter that happened with that fracture. A is going to equal to active treatment. So anytime the patient is being seen for that active treatment of that fracture, we're going to use A. D is going to be used for encounters after the patient has completed their active treatment. So receiving routine care during the healing process or recovery phase. So that active treatment doesn't doesn't just happen one time. So it could be, that they could be seen two, three, four times for that active treatment. But then once that active treatment has been complete and they're being seen for a healing process or recovery in the phase, then that's when we're going to code the D in that seventh digit. Osteoporosis is coded one of two ways: with a pathological fracture or without a pathological fracture. That with pathological fracture has to be a current pathological fracture. So in this example, the age related osteoporosis has a healed osteoporotic fracture of the lumbar vertebrae. So that is going to be coded to M81.0, age-related osteoporosis without current pathological fracture. And then it's going to, the other code that's going to be coded with that is from the Z category. The Z87.310 is the personal history of a healed osteoporosis fracture. And so then this next slide is when osteoporosis has a pathological fracture, and we would use this with a current fracture. And when it had a current fracture, you see that we're also going to drill down to where the fracture is, and it's in the right shoulder. And you're also going to use your A or your D here, telling us that it was the initial encounter for the fracture or they're in active treatment of that fracture. So we're using the seventh digit A in this scenario. Our last and final guideline for the musculoskeletal system is the multi-system inflammatory syndrome. And this actual guideline is found in chapter 1, not in chapter 13, but the code itself is within the chapter 13 codes. The reason why the guideline itself is in chapter 1 is because this particular syndrome is associated with COVID 19. So, when there is a um, current COVID 19 infection, that COVID 19 is going to be your principal, followed by your MIS code of M35.81. And then, when the patient has a history of COVID 19, and then they develop the MIS, they or you're going to use your MIS code as your principal, and then your post COVID 19 condition code, your UO 9.9, as your secondary code. And I'm sorry, that says COVID 10. It should say COVID 19. All right, so these are the procedures for the musculoskeletal system that we want to, refresh our minds to. Desis meaning binding fixation. So remember, your arthrodesis is surgical fusion of two bones to stiffen a joint. Your tenodesis is your surgical suture at the end of a tendon to a bone. Your spondylocentesis is spinal fusion, um, where you're immobilizing part of the spine by binding it together, fusing two or more vertebrae together. And see in this picture, it's depicting that cementing solution of fusing those that your spine together in this picture. And then remember, otomy is meaning surgical incision. So your fasciotomy is your surgical incision through the fascia to relieve tension or pressure. Let me move my little thing to the top so you can see all these pictures. And then your teniotomy is when you have surgical cutting of a tendon to provide release or allowing lengthening. So this picture is actually depicting when you have children that walk on their tippy toes, and then that tendon kind of stiffens up, so they need to go in and surgically cut that tendon so that it releases their foot back down so that they can walk on their heels again. My son actually still does that, but he didn't have it as bad as that. But I actually did teach a child that had to have the surgery, and then she had to be in a cast. All right. So our next one is plasty. So remember, that is molding, formation, surgical repair, plastic surgery. We have our total knee replacement. Here's a picture of one right here where they're replacing pieces of the knee so that the knee works again. Your total hip replacement, your hip arthroplasty. So see how in this picture it's showing you they're putting the metal in to replace that hip joint so that that restores your hip to full function. Sometimes they'll do a hip resurfacing arthroplasty. So see how it's not metal on both sides, but that metal kind of fits into the bone in the hip resurfacing versus the hip replacement. Shoulder replacement surgery replaces the top part of the humerus with a metal ball, and the damaged portion of the socket with a plastic prosthesis, which is what's going on in that first one picture there. Your percutaneous vertebroplasty, when they have bone cement injected in to stabilize osteoporosis related compression fractures. Remember that your ectomy is surgical removal. So the next picture is percutaneous discectomy, removal of a fragment of the disc that is compressing a nerve. And then your laminectomy, decompression surgery, surgical removal of the lamina. See where the lamina is compressing against that spinal cord. In that first picture, and then how they remove the lamina and so that the nerve is no longer being pinched. All right, so those are some procedures that you're going to commonly see in the musculoskeletal. So go back over your always go back over your medical terminology when we get into a new system so that you can remember, and then you can know what you're reading when you're going through and pulling out your important information for your diagnosis and your procedures in the medical record. All right, guys, this is the end of this video, and so you'll have those 5 questions and then your matching of your procedures with your pictures. Talk to you guys later.